Hi guys, my name is Portia and welcome back to my channel. So today I wanted to come on here and make a short video giving you guys tips on why ICU experience is important for CRNA school. Whenever I was taking my course this summer, there was a module that covered CRNA school, a history of it and why schools want nurses from the ICU. So maybe these tips will help you at work or help you on your journey to becoming CRNA, so you'll be more aware of what skills you need to hone in on and perfect before starting school or before applying to CRNA school. So if you guys are interested in that, stay tuned. So actually, I was in the middle of studying for my CCRN. I'm using the Barry exam book along with the past CCRN question bank. And so I was studying, then my mind began to wander, and so I decided to take a break from studying for a second and bring you guys this quick video. So there are 5 tips that they shared with us about what they look for in ICU nurse and why ICU nurses experience why ICU experience is important for CRNA school. The first thing is the ICU allows for you to develop skills and confidence to be an independent thinker. Because we all know certain areas of the country, CRNAs work independently and under anesthesiologists. But even if you work under anesthesiologists, you still are expected to be an independent thinker, come up with your own plan of care or anesthesia care plan for your patient. And if anything goes wrong, they're expecting you to step in and take charge of that situation. Okay, so first thing is being an independent thinker. The second thing are your medications. So at CRNA, you give all kind of medications, pain medications, sedative medications, paralytics, and blood pressure medications, heart medications. So they want you to be confident in your drips. From my understanding, during the interview, they only ask you about medications that are common in your specialty. For example, I'm a neuro nurse, so I wouldn't expect to be asked questions in detail about Esmolol and amiodarone. However, as an ICU nurse and as an aspiring CRNA, I should know those medications. I should know things as far as what they're used for, mechanism of action, and dosage. Okay, meaning is it kilogram based? Is it weight based? Is it not weight based? And what it's used for and mechanism of action. I expect all critical care nurses to know things like that. So that's why I would believe they would expect you as well. But as far as like details on titrating, I don't anticipate being asked those kind of questions because I don't give those medications on the regular. However, I think it would be good for you to know your dilators, your inotropic, the common inotrope medication, and interactions, side effects, and what they're used for. Okay, so the third thing they want you to know is how to interpret EKG and how to interpret your invasive monitoring. So your EKG, you need to know your lead placement as well as be familiar with what leads give what information. For example, what leads tells me about my inferior wall or my anterior wall, or what leads will tell me the patient is in a STEMI. The patient is having a STEMI, what will the EKG say? If they're having a STEMI, what will the EKG say, and what do I anticipate what happened? Things like that. Okay, and then your fourth thing is ventilation management. So based on what I've seen or read from other CRNAs, the machines are somewhat similar. The ventilation machine in the ICU and then the anesthesia machine, but I'm not completely sure about that. The course didn't mention that, but the course did say that ventilation management, meaning that if your patient is hypercapnic, what would you do? What settings would you adjust on your vent? interpreting ABGs. Your patient is in alkalosis or acidotic. What would those numbers look like, and what do you expect to happen to manage that? So that's understandable. And then your invasive monitoring includes your A-line, your CVP, your pulmonary artery, and your ICP if you're a neuro. You should know your normal values for those things, and if your CVP is low, if it's high, what do you think is going on? What do you expect to happen to correct that? All right. And then the fifth thing is being a nurse and being compassionate. So I don't think the ICU too much build compassion and sympathy and empathy for patients, because I think as a nurse, regardless of wherever you work in, those skills for the most part you already have, I think, as a person who becomes a nurse. But in the ICU, because you see patients in their vulnerable state, you see patients really in critical conditions, that skill is honed more or is shaped more in the ICU. So being able to have patient interaction, family interaction when dealing with anxiety or worry about what's going on health-wise, being able to combat a situation and being able to interact in a way that is beneficial to the patient and the family. So guys, that was it. I think 5 simple things. For the most part, I think all of them were familiar with anyway as ICU nurses, but I know for myself, I have to work more on the EKG interpretation and the leads, because I don't, as a neuro nurse, I do watch my monitors, but I can't tell you if lead 2 or lead AVL, what it tells me. Okay, so those I am working on. And also I'm studying for a CCRN. I'm using this book right here, so all the information is in this book, as well as I took notes from our course, so whenever the time comes, I'm going to be prepared. I mean, there's nothing that's going to hold me back from my preparation for my interviews and for CRNA school. So yeah guys, that was it. If you guys have any questions, leave it down below. Any videos you guys want me to do, leave it down below. Right now I'm actually transitioning from my old job to a new job in a new state. But I will give you guys information on the transition on next week, because I start next week. I'm excited. I'm a little bit nervous, but I'm more excited than nervous. The nervousness is starting to wear off. But I'm excited about it, and I'll keep you guys posted on what's going on with me as far as CRNA school. If you have any questions, leave it down below. And I'll see you guys next time. Don't forget to subscribe.